Well, hello, Marcia, and thank you so much for joining us today. How are you?
I'm really good, thank you. I'm really happy to be here, so thank you for inviting me.
Oh, we're just delighted to have you on. Why don't we start with you telling us a little bit about yourself and your story?
Absolutely. So actually last Friday, I was celebrating my 25-year cancerversary. So it was 25 years on Friday, the 9th of June, that I had my mastectomy. That was second lot of surgery. So that's the one that kind of really sticks in my mind. Because it was also happened to be my son's birthday, as well at the time. So he was only 5. So everything was happening that day. Um, so yes, my going back 25 years to 1998, I was 32 and I had 2 little boys, aged 2 and 4, and I just happened to find a lump in my breast myself. It was just in the crease of my right breast, and I discovered it when I was bathing and just kind of didn't really do much about it or think it was anything sinister for quite some time. I suppose because of where it was, because it was just in the crease of the breast, it felt like a little bit of cartilage above the rib, and I thought, well, I'm 32, so it's really unlikely to be anything sinister. But anyway, as time went on, the weeks went on, and I finally told my husband, and he encouraged me to go and have it checked out. So I did, and again, nobody was really concerned, but they did refer me to have the investigations, to have an ultrasound and a fine needle aspiration. And it wasn't until the results came back from the fine needle aspiration that they were suspicious. And yeah, so that was, a huge shock. Certainly wasn't the news that I was expecting to hear. So I had a wide local excision where they removed a segment of my breast, and it came back as being DCIS, so ductal carcinoma in situ, but they didn't get clear enough margins, and they suggested because ductal carcinoma tends to be a little bit kind of spread out through the breast, they wanted to take more of the breast away, and because of the size of the breast, they recommended, cosmetically it would look better if I had a mastectomy, and they would give me an immediate implant. So again, that wasn't news I wanted to hear. I didn't want to be really contemplating a mastectomy at 32. But at the end of the day, I just wanted to do whatever it was going to save me and to enable me to be around for the boys. So yeah, the mastectomy went ahead, and I was lucky enough to be able to have an immediate reconstruction. So I had a saline expander put in, and that was really successful, actually. I think the cosmetic result of that was really good. I was able to, and I know it's really rare, but I was able to preserve my nipple. So that was another thing that sort of just kind of helped a bit. And the results that came back from that was that some of the DCIS had become invasive. So I'm actually quite relieved that I'd taken that decision to have the mastectomy. So because of the size of the invasive tumor, it was very small. It was 4 millimeters of invasive cancer. So I didn't need to have chemotherapy, and that's 25 years ago. I don't know if the protocols have changed or not, but I didn't have any lymphatic invasion, and I took tamoxifen. So that was my treatment path. And I just remember at the time, the doctor said to me the surgeon, when he came around the next day after the mastectomy, still, you're one of the lucky ones. And I really couldn't appreciate his words. But knowing now what I do know about cancer and about different types of breast cancer and everything, he knew what he was talking about. But it's taken me quite a few years to actually realize and appreciate his words. So
Thank you. Thank you so much for sharing your story. I'm sure many of the people watching or listening can relate to being surprised, can relate to delay in getting something attended to because of their age. Treatment has not changed. So right now, unless there were some characteristic of the invasive cancer that were particularly concerning, which would be unlikely given the size of the tumor, chemotherapy would not be recommended today either.
Okay. Oh, that's interesting.
I do want to comment on you're one of the lucky ones. There's this notion of the good cancer, or you were so lucky, and here you are without a breast. And
that is exactly what I was
yeah.
thinking.
So what he really meant was you have a good prognosis. He did
Yes.
mean you're lucky, but we're not trained in medical reassurance. Isn't that interesting? We're trained in how to give bad news, but we're not trained in how to give good news. So it's one of my missions to help people understand how invalidating that is. To
Yes.
say,
Yes.
lucky.
Yeah. No, it was a bit of a surprising comment, but he was a larger than life character, and he also kind of slapped me on the leg at the time as well. He said, "You're going to be all right, old girl." So, that's just the way he was. And
what I love is it's 25 years later and you remember these things, right? They
oh my
stick
gosh,
in your
every
memory.
single word.
Yes.
It will never leave me.
Yeah. The slap on the leg, you're going to be all right, old girl. Yeah. Thanks for sharing all of that. I think that's really helpful to other people to hear your own story and maybe see themselves in what you've been through. I'm really curious how you ended up in the world of yoga. How did you discover yoga and make it part of your life?
Well, some weeks after, in the aftermath of the surgery and the appointments and everything, all the sort of the diagnosis and the trauma of the surgery and everything that you kind of just go through because you have to do it. So you just go through it without kind of thinking about it too much. But afterwards, I was suddenly overwhelmed with all this emotion of what I'd been through, and I couldn't wait to be the other side of everything. But when it happened, I was really tearful. I was really anxious about reoccurrence. I was short-tempered with my children. I just wasn't my calm, natural self. And I was really surprised at how I reacted to it all. So I did go to my GP and talk to her about it. And she said, I think you should go and have some counselling. But it didn't really appeal to me. I didn't fancy counselling. I wanted to try something different. And I just thought, I'm just going to go and try yoga. I didn't know anything about yoga, and I just knew that it could help you rebalance your body. And I felt that my body, both physically and mentally, was really out of balance. And so I just took myself off to a yoga class at the local gym. It happened to be an Iyengar class, so very precise, really focusing on good alignment and everything. And I really liked that aspect of it. I liked the fact that it was very specific, and that really helped me. I ended up going twice a week, so I'd drop my little one off at nursery and dash back to it was in London. It was in Euston, his school, and then I'd go back to Hampstead and go to this yoga class, and it was my lifeline. It really helped, and it was just so powerful. I honestly didn't know how it was helping me, but it was helping somehow, and that was the start of my relationship with yoga.
So it's been a part of your life, a part of your practice for a very long time.
Yes. Yeah. I mean, ever since that time back in 1998, I've been practicing yoga regularly throughout my life for the last 25 years. And subsequently, I then trained to be a yoga teacher, to teach general yoga, but then decided that I actually wanted to go more down the sort of cancer route, to specialize in teaching yoga for people affected by cancer, because it just resonated with me. It's something that that really helped me, and I wanted to share that practice with other people. So I did some specialist training to teach yoga to people with cancer, and I'm now training to be a yoga therapist as well. So I'm just over halfway through my yoga therapy training. So yeah, and hopefully, that will help to further support my cancer clients.
You really are a lifelong learner, and you've taken something that happened to you and disrupted your life and turned it into your life's work.
Yeah. I mean, I didn't know at the time. It just, these things evolve, don't they? You find a path that you happen upon that you don't think you're going to happen upon, and you just take that path, and and it leads to other things. And yeah, I really do feel, I mean, in yoga terms, they'll say it's your dharma, your reason to your purpose in life. And I do feel that I'm doing what I'm supposed to be doing. I'm really passionate about sharing that practice with people going through cancer, but specifically, I mean, I guess I specialize in breast cancer clients, because that's where my sort of personal experience has been.
Well, it shows on your face how much you're committed to it. You mentioned the type of yoga that you do. Would you mind spending a moment talking about the different kinds of yoga that are available?
Gosh, there are so many different styles of yoga out there. And some styles of yoga won't be suitable for those recovering from cancer. So I'll talk about the ones that I would avoid, or recommend avoiding in the early days. I mean, it's not to say that you could get back to doing a more vigorous practice later on, but certainly when you're recovering from surgery and treatment, you want to avoid the hot yoga classes. So you don't really want to be elevating your body temperature abnormally. And those hot yoga classes do tend to be quite dynamic. So they'll move very quickly through the poses in a vinyasa flow style. So you'll be doing a lot of sun salutations, a lot of chaturangas, which is where you lower down from a plank, press up, and then come into an upward facing dog, which is a back bend, down, and then back into a downward dog. So there's a lot of upper body strength required to do those practices. And that's something that you can build up to very gradually, but certainly not in the recovery period after cancer. So another dynamic practice would be Ashtanga yoga. Again, that's not something that you would want to be doing. So hot yoga, Ashtanga yoga, Vinyasa flow yoga. I would recommend, if you can't see a specialist teacher and you want to go to your local yoga studio or gym, to seek out a hatha yoga class or an Iyengar yoga class, or possibly a restorative class. Now, all of those are fairly different, but the hatha and the Iyengar will focus on good alignment and strength building. So, we in our yoga practice, we do want to work. We're not just going to be lying around breathing, because it's really important if you're recovering from treatment, maybe you've lost a little bit of muscle tone, you've lost a bit of bone strength, you need to be gradually building that back. So by doing a slightly more active practice where you are moving in and out of the postures with awareness, so you're pumping the muscles, you're getting the heart pumping, you're getting the lymphatic system working. All those sort of poses where you're moving with the breath are really good for your cardiovascular health and your lymphatic system. And then there'll be poses that you will hold, so we'll be holding maybe standing poses such as Warrior 2, or maybe a standing balance such as Tree Pose. And, that's focusing on the strength and the balance aspect of the strengthening the bones, but also building up balance and proprioception in the body, which again is something that can go, you can lose a little bit of balance, and especially if you've got peripheral neuropathy as well. So, practices like that will really help to build strength in the muscles and the bones. And then, we can then incorporate some more relaxing restorative poses into that sequence as well. But I wouldn't say necessarily go for a completely restorative practice, unless there are times when you feel that your energy is absolutely at a low ebb, and then they have their benefits then. But if you're trying to sort of recover and rehabilitate and build back a bit of strength, then I would seek out a hatha or a Iyengar class. But ideally, and I know it's difficult, it's not always easy to find specialist teachers, but if you can find a specialist yoga for cancer trained teacher, that would be the ideal scenario. And they may run special yoga for cancer classes at local cancer support centres or at local charities. They over here in the UK, we've got them both in person and we've got them both online, so we can reach quite a wide audience, even people overseas, depending on the time of day that they're at. And then another option would be to actually seek out a yoga therapist, and that's a slightly different offering to going to a regular yoga class, because it's very bespoke to that one person, and you see your therapist on a regular basis, and maybe weekly or every 2 weeks, and they will put together a very bespoke plan. So they'll not just look at the cancer, they're looking at the whole person. They're looking at how that affects the whole being, and developing a practice that will be very bespoke to that person. And then you'll practice it on your own at home. So those are the options that are available. I hope I haven't missed out anything else in terms of what's around, but I am very aware that it's not always easy to find a yoga for cancer chair. I mean, there are organizations that you can seek out, such as Yoga Alliance, which is the accrediting body. It's it's a US based accrediting body, Yoga Alliance. So they have a directory of yoga teachers, and then you could find out some that have specialisms in cancer, yoga for cancer. There is also the International Association of Yoga Therapists. And again, you could, if you wanted a one-to-one, you could seek out a yoga therapist who, all yoga therapists will have been trained in cancer. So that's a pretty safe bet.
Thank you. That's really helpful. You mentioned the benefits of yoga to the body, and I'm wondering if you could just summarize those again. So what can yoga do for the body in recovery?
Okay, so in recovery from breast cancer, well, I can certainly talk from my personal experience in terms of helping me to calm my anxiety. And I know that that's something that a lot of my students actually experience, when they've been through everything and they've finished their active treatments and they're trying to get on with their lives, that's probably the most difficult part generally. So in terms of actually using yoga as a tool to help to sort of calm the nervous system, that's mainly yoga works on the nervous system, how it affects the nervous system, and it's through the breathing practices. It's through the awareness of the breath, and there are certain breathing practices that we introduce that helps to tune into the parasympathetic nervous system, which helps you to relax, rest and digest, and come out of that fight and flight, which you tend to be. You kind of hold yourself in check when you're going through treatment, and you do find yourself, I know for myself, I was in this fight and flight state, even though I might not have realized it at the time. And then, it's afterwards that you sort of kind of take a few breaths and come down from that and realize the magnitude of actually what you've been through. And that's where yoga can really support you through the breath work, but also through the movement of the body with the breath, because we hold a lot of this trauma and emotion in the body, in our tissues. So by moving the body through some simple half sun salutations, where you're not doing the usual planks and downward dogs salutations, you're elevating the arms, you're opening the chest, you're mobilizing the upper body, you're stimulating the flow of energy around the body. So that inhalation is lifting the energy, and you might be feeling tired, you might be feeling fatigued and anxious, but actually just alleviating and getting the energy moving around the body and alleviating those feelings of anxiety and depression, or whatever it is, with insomnia that you might be experiencing. Yoga can really help in that way. And also the use of sound in yoga as well is really important. You know, you don't have to, and I know some people feel a little bit self-conscious, you know, making a sound in yoga, but it can be something, we have something called Brahmari breath, which is called a bee breath, where you make the sound of a bee. And that resonance that you feel in the mouth and the face when you make that sound has a really calming effect on your nervous system. Or in fact, you could make any sound. You could make a sound that, you know, just resonates with you, that you enjoy making in a really long, controlled way, just to lengthen that exhalation and help to calm the body. So, you know, yoga, there are so many aspects of yoga. It's not just the asana, which are the poses. It's also the breath work. It's the chants, the sound work, and the mudras. You can make simple handshakes, and it's amazing how effective you know, the simple mudras are to help to calm the body and integrate the nervous system. Yeah, so we have a lot of tools at our fingertips as yoga teachers to really support somebody who is in cancer recovery, and you know, as well as, you know, calming down the nervous system. We can, as I said before, you know, building back that strength, but also empowering the student to actually support themselves. You know, so if we can give them breathing practices to do, or simple movements that they can actually do at home, or if they're going back for checkups before a scan, if they're feeling a little bit anxious, and if they feel a bit self-conscious about doing these breathing practices in front of people, you can actually imagine them, you can visualize them. So there's a lovely breathing practice called alternate breathing, which helps to really balance the body, the right and left side of the body. But, you know, you might not want to take your fingers up to your nose and start to close off nostrils, but you can actually sit in a waiting room and you can visualize that breath coming in through one nostril and out through the other. You know, so you can do these things very discreetly.
It's really, you know, we talk about yoga being an integrative practice, and it sounds like it really not only is it integrated with other treatments, but it helps us integrate what's happened to us and our bodies and spirits. So I love the description. You also mentioned it can help regain strength, improve lymphatic drainage, which we've learned since you were treated that the favoring of the arm on which side the surgery was is actually the wrong thing to do. So we used to have people not lift more than 5 pounds with the side that had a lymph node dissection. A randomized study showed that actually weightlifting was better than babying the arm in terms of keeping that lymphatic flow. And that sounds like one of the benefits of yoga as well. Does yoga help with bone density?
Yes, it does help with bone density. Because we're using our body weight. So we're not using any extra weights in our yoga practice, but because we're using our body weight by even just being on it in an all fours position, just a simple all fours position, you know, you're already, you know, you're placing your weight through your arms and through your shoulders, but in a gentle way, in a controlled, gentle way. The standing poses where you take the weight onto one foot, such as tree pose or maybe warrior 3, something like that. That's, you know, again, having that ability to load more weight onto one limb is again, you know, building up bone strength. So we don't need to necessarily, I mean, it's great to have a resistance training practice as well, but in yoga we can certainly support improving bone health and strengthening the bones through the balancing practices. We don't do too many arm balancing practices in the yoga for cancer classes, but you know, again, that's something that you can maybe, if it was in your practice before and you're a really dedicated yogi and you want to get back to doing those things, I mean, that's certainly something that I've developed over the years. And I mean, I had a few lymph nodes removed, but I didn't have a full clearance, and I've been fine. But I understand, it's my understanding, and please correct me if I'm wrong, that, you know, building up very slowly and gradually with increasing the amount of weight that you're either using through training or that you're placing on your arms through a yoga practice is really important. So not over holding any poses for too long. and also doing it with awareness, ensuring that you're not feeling any odd sensations in your upper body, or whatever affected part of the body that is affected, but generally the upper body. Yeah, so really practicing with awareness, building up very gradually. And if I was working individually with somebody, I would really tailor, obviously, what I was doing to what they wanted to achieve in their practice and work to it very slowly. But when I'm teaching a group class of people through different stages of ment, I will very much tend to play on the safe side, and make sure that give people lots of options to come out of poses, to modify, and lots of modifications for different arm positions as well in the practice.
I think it's so important to give people options, because during cancer treatment, you're sort of passed around from doctor to doctor and told where to be when, at this doctor at this time, whether it works with your schedule or not. One of the things I hear a lot from my patients is that they lose control. So I love the way you're handing it back to your clients.
Yeah, absolutely. It's about empowering the student to take charge of their well-being, and to have something in their calendar that isn't a hospital checkup or a scan or whatever, to have that regular slot, ideally twice a week, if you can get to yoga twice a week, to have that time dedicated just for them, where they're just looking after themselves, and really feeling empowered then to maybe take some of that practice home with them, and use some breathing practices and simple things whenever they need to. So I think that's really important. That certainly was for me as well. That really helped me.
I just felt myself take a deep breath, and it's as you were talking about a deep breath, and if people are watching this, they probably saw that. We hear the word empowerment a lot, and I wonder if you could tell us what you mean by the word empowerment.
Well, for me, it's something that it's not telling the student what to do. It's giving them the tools that they can actually use when they need to use them, giving them the confidence to think, well, actually, to listen to their body in the first place and realize how they're feeling. At the beginning of all of our yoga, the yoga classes that I teach, we always start off in that relaxed, restorative position, and we go through what we call in yoga the koshas, the different layers of the body. So we have the physical layer, the energetic layer, the mind, the mind and emotion layer, and then the wisdom body, and then right in the center is our bliss body. And we think about things that, tiny little things. It doesn't have to be anything major that bring us happiness, that bring us joy. So we work through all those layers of our being, and it's bringing that awareness into the student to notice how they're feeling on any given day. And that can change. That changes for all of us, and how we feel throughout the day changes. Our energy changes. So it's first of all bringing that awareness to them so they can recognize how they feel, and then giving them the tools to actually help themselves. So if they're struggling to sleep at night, to give them a meditation that might help them, or a guided visualization to help them sleep. If they're feeling like they need to just move their body, to encourage them to do some half sun salutations, or just some really there's a whole host of things that we can give them. It doesn't need to be anything complicated, and it can just be like a 5 or 10 minute practice. And always the breath work. You can always come back to the breath work. The breath is really the most important aspect of your practice. I mean, a lot of people think, oh, it's the asana, it's the poses, because they see these images on Instagram of these crazy contorted positions, but really that's not yoga. Yoga is that self-awareness. Yoga is the breath. Yoga is how you look after yourself, how you make the right choices in your life, how you make the right choices about what to eat and how to look after yourself, and just treating yourself with compassion. And that's what yoga is. It's not it's not the craziest wacky pretzel pose that you can see on Instagram. So that's what empowerment means for me. It's encouraging, it's giving the student the tools to help themselves, not telling them what to do.
That's really helpful. I heard listening to themselves at the beginning, and I'd never heard the term bliss body. I love that. And also, then, as you said, giving people tools so they can make choices to take care of themselves. I think that's a terrific two-part definition of empowerment, that listening to the self. And, after a cancer diagnosis, so many people have told me they feel betrayed by their body, and help them once again listen to and trust their body seems a little bit a part of what you were talking about as well.
Yes, I think that's really important, but it can take time. It can take time to build that connection back with the body, because you dissociate from the body when you're, when you have part of your body removed or interfered with through whatever treatment, you dissociate, and it's then trying to bring that awareness and acceptance back into the body. And I use touch a lot in the practice as well, trying to just encourage people to place their hands wherever feels comforting for them, whether it's on their lower abdomen or their rib cage or the heart or the head, So using kind of self-touch can really help rebuild that connection with the body and how you're actually, and that sort of interoception, that how you're actually feeling really deep inside. Yeah.
I know our listeners and viewers are going to find this so helpful. So when can people start doing yoga? Let's say they haven't had a yoga practice and they've just been diagnosed. When would you recommend that they introduce yoga in whatever form into their lives?
Well, first of all, the most important thing is that they need to have the consent of their doctors, physios, whoever, their medical team to start to exercise. And I find that it's usually about 6 weeks. But then I guess it depends on the type of, if they've had a reconstruction and the type of reconstruction that they've had. So if they've had a DIAP reconstruction, then obviously you've got the lower abdomen to be dealing with, and I think that possibly takes a little bit longer. I mean, I haven't seen people 6 weeks post DIAP reconstruction. It's been quite some time after. It's been months after that. But so I don't know what you would recommend in terms of going, starting yoga after that sort of reconstruction. But usually, if it's a mastectomy or lumpectomy with maybe silicone implant or whatever, some other sort of reconstruction, it's usually 6 weeks minimum. So that's what we usually say, but we always say you've got to get the consent of the doctor before you start to exercise. But sometimes people have different views of yoga as well. Some doctors think yoga is lying around with lots of bolsters and supports, and some yoga is, but the yoga for cancer programs that are generally run are more active as well. So the students will be moving around quite a bit, but it's usually 6 weeks, and we build up gradually, and we also absolutely make sure that the person is in tune with their body and their breath throughout the practice the whole time.
So how should people, I know many of our listeners and viewers are going to think, my doctor doesn't know anything about yoga, because it's the case, that many of us are not familiar with the art of yoga. I'm curious what sort of short description they could give their doctor to make sure they're getting the appropriate, we call it clearance, to exercise. What, just 3 things that somebody listening could tell their doctor in order to get the okay to move ahead.
So, for example, I would give some examples of how they're going to place the body in the practice. So, am I okay to go on all fours, to go to a kneeling position, placing weight on my hands, with my shoulders over my hips over my knees, and make some spinal movements, which we call cat-cow. So that all fours position, that's a pretty standard kind of warm-up that we do in the practice. That would probably be that would give them a good idea. Weight bearing on all fours, but with the knees down. So you're not in any plank position, just all fours. The rest of the poses, standing poses, because you're weight bearing on your legs aren't going to be such an issue. The movement is going to be modified with the arms in order to support the individual. But the focus of the class really will be focusing on strength building in the legs. So really building back those big muscles, the glutes, the quadricep muscles. So the standing poses there, incorporating arm movements with the breath. So mobilizing the shoulders, a little bit of strength building, but we use strength building by using eccentric strength. So really imagining that you're moving against imagined resistance. So there's no kind of weightlifting or anything. So that's an example. I don't know if I've said that really very clearly then, but that's an example of what one of my classes would incorporate. Those are the more active types of poses. As I said, we start off lying down, breathing. We then mobilize the joints in a supine position. So we're lying on our backs, mobilizing shoulders, mobilizing hips, toes, all the joints in the body before we then come up to an all fours position, then begin to mobilize the spine. But yeah, I really think the all fours position is probably the strongest position. And then we might take a leg back and we might take an arm forwards. But, there's always modifications that you can make for the individual.
That's really helpful. I think that's exactly what people need to know to tell their doctors. And I would just add from a medical oncologist standpoint that if I had somebody with bone metastases, I would also want to get special permission for weight bearing. My guess is you do work with people with advanced cancer, and most people are not fragile. Patients, I've done some work where we found people with advanced cancer had this sense that they were very fragile, and that wasn't actually the case. So I think the work that you're doing can help people feel less fragile. And again, as long as they have clearance.
Yes. As long as they have the clearance, they can start to build back the strength. Yeah.
Are there any people for whom you think yoga would be ill-advised? Any clinical scenarios that would make you as a teacher concerned about having somebody start in a class with you?
In a cancer environment? No, I mean, I have people at all stages of their treatment. So I have people with PICC lines practicing who are going through chemotherapy with ports. It doesn't stop them practicing. Really, yoga is a very inclusive practice, and the beauty of it is that it can be modified. So we can use props. I've experience of working with people who are amputees, and we find ways of supporting them in their practice. So I can't think of a scenario where I would not recommend it. It's really just the timing of when they start the practice, and modifying it. And if there were more challenging issues with that person, if they had other comorbidities that were going on aside from the cancer, then we'd have to take those into account as well. So there might be something that, outside of the cancer diagnosis that might be affecting them, in which case it might be more appropriate to have a one-to-one. So it might be more beneficial for that person to have a more personalized practice as opposed to being in a group.
I think that is great news, that there's nobody for whom yoga can't be part of their self-care and their healing. And the integrative part, the breath, the mind, the body, I think must be so appealing. I hope to our listeners and people watching this as well.
Yeah, yoga is for everybody.
It's
and for the whole life, your whole life.
It's an equalizer. Yeah, and it's I love the word inclusive. As we bring this to a close, is there anything else you wanted to say that I haven't asked you?
In terms of actually finding a teacher, so I know that you're a US-based business company. So you might want to be seeking out US-based teachers. And I'm sure you're aware of Tari Prinster, who wrote the book Yoga for Cancer. She is a yoga for cancer teacher and also a breast cancer survivor herself. She's got a fabulous book, and her website is really informative, has so much information on it. So in terms of finding teachers, I think she has a directory on there of all the teachers that she's actually trained. So if you're US based, that would be really helpful. As I mentioned, also the IAYT, which is the International Association of Yoga Therapists. You could find a yoga therapist if you wanted to work on a one-to-one basis. And then if the time zones are suitable for you, I teach online from my home studio at 9:30 every Tuesday morning, 9:30 to 10:30. And then have a couple of other online options, which are slightly later in the day, so I don't know if they'd work or not, but on a Tuesday lunchtime, I teach 1:15 to 2:15 with Future Dreams, which is the breast cancer charity based in London, and I teach online and in person there. And also with a cancer community called Get Me Back. It's a cancer recovery app that people can join to do fitness training programs, and I teach the yoga part of the cancer recovery program there. So those are some options. Some of them may work for you, some of them may not, but there are a couple of US ones in there as well, which hopefully you'll find helpful.
You are very busy. How can people find you on social media?
I'm on Instagram, and my handle is at Yoga for Breast Cancer. I've also got a Facebook page, which is, I think, again, at Yoga for Breast Cancer. And my website is Marcie, MARCIE.yoga. And you can find out more about me on the website.
Thank you so much. This has been a wonderful conversation. I really appreciate your time and expertise.
Oh, well, I really appreciate being invited to talk to you. I feel really honoured, so thank you.